I'd like to welcome everybody to today's webinar, Lead Poisoning Prevention Program Ideas from the Healthy Homes Partnership. We have a full house today. We're really excited about this webinar. A couple of the logistics. Everybody has a muted mic at the moment, just because we can maintain the good sound quality with that. During the question phase at the end, I will be unmuting everyone's mic. If you need to ask a question during the webinar, you're welcome to type in the chat window your question, and I will try to let Martha know and our presenters know that you have a question. We will be going for about 45 minutes with 15 minutes for questioning. And we are recording this webinar so that you or anyone else in your organization can watch the webinar at a later date. I'd like to welcome everybody to the webinar. Today's presenters are Dr. Martha Kuehl, a professor at the University of Tennessee Extension in the Department of Family and Consumer Sciences, and she has served Tennessee families for more than 34 years. She is an extension specialist in the area of environmental health and housing, and Dr. Kuehl is recognized as a national leader in the Healthy Homes movement. She is co-presenting with Dr. Bonnie Hines, who's a University of Tennessee environmental health specialist focusing on childhood lead poisoning programs. So, Martha, take it away.
Yes. All right. First of all, I want to thank you for giving us this opportunity to do this. We're very excited about our program in Tennessee and hope that we can offer some ideas for folks, or at least a resource. And if anyone ever has any questions at the end, they're certainly welcome to contact either Bonnie or myself. Actually, in Tennessee, we've been working in this whole arena of healthy homes starting in the 1990s. At that point, a program that was initiated by USDA and an EPA agreement was Healthy Indoor Air for America's Homes. And I was one of the first states to become a part of this program. In about 2003, the state of Tennessee started their lead poisoning prevention program. They got an initial grant with the CDC, and at that time, they approached us about being their outreach arm for that program. Of course, we were delighted to do that. So that started in '03. After a few years, just as a side note, they actually got us to do their lead poisoning surveillance at the same time. So that's a little bit of something that we do on the side, but we actually are into the surveillance and actually handle all the data of that. But our outreach is where our real strength is. For some reasons, the state actually withdrew from the CDC funding for a few years, but they were still very much committed to the program, so they self-funded. And then in 2015, they reapplied and got CDC funding again. So that's been a program the state is really committed to. In some of the other programs throughout our history, of course, the Healthy Home Partnership started in Tennessee, was one of the initial states that was a part of the partnership.
Martha, I hate to interrupt you. I just want to make sure, are you advancing slides on your end? Or are you still on the first?
No, not yet. Not yet.
I just want to make sure. Okay, sorry to interrupt. I just want to make sure that we weren't we were seeing what you needed us to see. Sorry, go ahead. I'm sorry.
Yeah, no, that's fine. This is just kind of a brief history.
Perfect.
Then we actually became a part of the Children's Environmental Health Network, which was a partnership with the CDC. In 2008, we became a training partner for the National Center for Healthy Housing, which became kind of a nice fee-based program for us. During that period of time, HUD funded a project with Middle Tennessee State University, the 10 LEAP program, which was a lead elimination program. And We didn't get any funding from that, but we were certainly active partners with them. In 2015, we got a project through the Rural Health Association, and at that, our proposal was to do the Echo Healthy Childcare training, which is a course that's offered through the Healthy Home Training Center. In 2010, the City of Nashville applied for a lead demonstration grant through HUD. They got that grant, and we became a subcontract on that project, where we did some training, and we also set up a lead safe housing registry. Knoxville, after that, applied for one. And again, we were a resource for them. We were not an actual subcontract, but we did some training for them and worked with them. And in 2016, Chattanooga has received a grant and has approached us to be a partner with them. So we've been working in this arena for over 20 years. And the issues are still as relevant today as they ever were. In fact, they probably are more so.
Good morning, everybody, and happy National Lead Week to you all. My name is Bonnie Hines, and I coordinate the outreach portion of the Tennessee Childhood Lead Poisoning Prevention Program. And I don't want to spend much time on how that's organized, but just enough so you understand how we have the capacity to do the outreach that we're talking about today. As Martha alluded to, we are part of, I think, a really dynamic group in the Tennessee's Lead Poisoning Prevention Program, which is administered by the Tennessee Department of Health. We are one of their contracted partners, as Martha said, to do the outreach and surveillance portion of the program. And the third arm of that partnership is the Department of Environment and Conservation, who actually performs the environmental investigations for those children with elevated blood lead levels. And we're sort of married amongst us by a statewide advisory committee that is parented by the Department of Health and facilitated by us. And that advisory committee has really become a valuable resource for training for leaders in CLIP across the state. We meet face-to-face at least twice a year and have a lot of educational sessions that really give people all of the aspects of the whole lead poisoning picture. So that's how CLIP itself works. And of course, we are undergirded, empowered, and absolutely magnified by being a partner in the Healthy Homes Partnership nationwide. I also want to mention, when we talk about outreach, we do the biggest chunk of that, but within the Department of Health, they have a recognized coordinator in each public health region who also perform some outreach and are very instrumental in working with the medical providers in their areas. So that's a valuable piece of the program. But let's talk about outreach. That's why we're here today on this important week for lead poisoning. I just wanted to give you an idea of what our educational materials look like. In the last couple of years, we've updated our logo, which we had one designed a while back with a whole group of children, but we wanted to kind of emphasize younger kids. So what you see on your screen now are our cover kids, the little African-American girl on our general informational brochure, and the little boy in the big hat. So we want people across the state of Tennessee, when they see one of those kids, to know that lead poisoning is what we're going to be discussing.
I want to talk a little bit about our structure. We are in the Department of Family and Consumer Sciences, which is at the state level. It's where all the specialists reside. But in our state, we still have I apologize. We still have county agents in each county. And my computer's about to die. I apologize. I've got to get it plugged up real quick. We still have an FCS agent in every county. That's not true of most states anymore because our organization has a commitment to serving the families of Tennessee. And we know that families have a lot of issues, and they're not just concerned with one or two issues. We try to look at the family holistically and all the issues that are affecting families today. And of course, housing is one of the main issues. With those agents, they can range. The small counties may have 50% of an agent that's designated to family and consumer sciences. And then in some other counties, larger counties, we may actually have 2 or 3 agents that do programming in this area. So our organization has philosophically always wanted to give a presence of support to all the families throughout the state. One way that we do this is that we have what we call leadership teams. And this is the way that we get agents in on the planning part of our programs because they have the experience of what's happening at the local level. We had originally 4 leadership teams. There was one in food nutrition, there's one in human development, there's one in family economics, and there was one in health and safety. But after a few years, it became very obvious that environmental health and housing needed its own leadership team because our programs were literally all over the state, and it was just pulling those agents to them because health and safety was all of our chronic disease programs and a lot of different kinds of programs. So we now have our own leadership team. We just last month actually made a trip to Louisiana. The Claudette Reichels right there, some of you may know her on the right. So to give some of these agents training and a tour of La House. So that's a way to generate excitement among the agents and get them really vested in this program. In our state, even though we do have every area represented at the state level, we cannot mandate to the agents to do the programs. We have to market our programs to the agents so that they, number one, see the need, and number two, have the desire to actually offer these programs. So this leadership team is very important in making this happen.
So as we start to talk about the outreach that we do, we wanted to start with the agents and the counties, which is really what makes us, I think, attractive to the Department of Health to lead their outreach piece, that in each of those counties we have the ability to access the important partners in housing, the important partners in early childhood, the important folks who can communicate with local healthcare providers. So when we talk about what goes on in the counties, one of the first places and that agents actually perform lead outreach is for Head Start. It may be different in other states. In Tennessee, Head Start is the only place other than with our TennCare patients that there is, which is Tennessee's version of Medicaid. Other than that, the only place where we have enforcement ability is in Head Start, where children must have received a lead screening to become part of their student body. So because of that, our agents, particularly at the beginning of the school year, spend a lot of time in Head Start talking to the staff so they understand why it's so important that those children are being screened, talking to the parents of those children so that they understand what that screening is and what it means to them and where to go if in fact it reveals an elevated blood lead level. And increasingly since 2015, performing the Eco Healthy Child Care curriculum, something that became available to us through the Healthy Homes Partnership. 45 of our 95 agents are trained in Eco Healthy Child Care, a big portion of which that curriculum covers lead poisoning prevention. So Head Start is a huge issue for outreach with our county agents. Also, they perform some of the classic public health extension activities that we're familiar with across the country. Your classic health fair that can talk about any number of health issues. Some of them also have screening activities with them. But if there's a health fair in a county, either one of our extension agents or one of the public health educators from the Department of Health will be there and will be talking about lead. Because we know the logistics of those who live in less, in more impoverished neighborhoods, that the Minority Health Fair is a major place to market lead poisoning prevention. In our communities, increasingly with all kinds of health topics, but particularly with lead, in faith-based events, our agents are there and they're talking lead. We often pair lead poisoning prevention with poison safety of all kinds. That's a topic that our agents particularly like to share with the community, and lead is partnered with that quite often. As in, I'm sure your community and your state, community festivals, celebrating whatever it may be, our agents often take a lead message, a lead display, a lead exhibit there. And the community baby showers are hugely popular both with extension and public health as a place with expectant mothers and mothers of newborns to understand the importance of lead screening and lead safety. So those are some of our more classic opportunities for agents to perform outreach. I probably shouldn't say this on a national call, but I will tell on myself that when it comes to our county agents, as well as statewide conferences, I often barter whatever they're asking me to do for. I will be happy to do X for you if you also include lead poisoning prevention as part of the deal. So that's one of my little professional secrets that I've just divulged to all of you. It works. Through Eco-Healthy Childcare and that outreach, our agents have expanded their work with preschool-age children from just Head Starts into all kinds of child care facilities. It really, we heard from them, opened the doors to some private child care facilities, to early educators in public schools, doors that weren't necessarily open before. That curriculum has been wildly successful. And the lead poisoning emphasis there follows them not just through Eco-Healthy Childcare, but independently, and it's on its own. To teacher in services, a lot of our agents do outreach as parents come in April and May to register their kids for kindergarten, a perfect time to talk to parents and about lead poisoning. Have their kids been screened? Let's hope so by the time they're 5, but if not, they're going to leave with that information. Once school resumes in August and September, it's a great opportunity to do outreach at those back to school events, PTO meetings, all kinds of places where our agents can access young children and their parents. It's happening there. Increasingly in our state, probably a trend across the nation, is grandparents who are raising their grandchildren many times in homes that they have resided in for years and years and years, homes that can contain lead. So we're making certain that grandparents who are raising their grandchildren, as well as grandparents who are just enjoying their grandchildren in their own homes, understand the risks of a pre-1978 home, or even some of the products that may be in that post-1978 home in terms of their grandchild's safety from lead. So talking to grandparents is a huge component as well. So that's kind of the educational backdrop that our county agents provide. And of course, we are extension, and agriculture is in our genes. and it's certainly in the outreach that our agents perform. So if you attend a county fair in the state of Tennessee, you can pretty much expect to see a lead poisoning exhibit in Extension's corner. When our agents work with their county agricultural counterparts with agricultural events, certainly there's an agricultural aspect to lead poisoning, and you can expect to see it emphasized there. Our master gardeners work closely with both the ag and the FCS extension agents, and when they have an educational event, by golly, we'll be talking about lead in soil. And any of the eco-friendly kinds of events, whether it's Earth Day or something along those lines, our agents are probably out in their counties with a lead exhibit focusing on lead outreach there as well. And one of the ones that I don't know if it's distinct to Tennessee, but our agents, knowing the targeted groups for lead poisoning issues, those who live in substandard housing are also those who may attend commodity distributions, and they frequently market lead poisoning prevention there, as well as a lot of other topics that are relevant to a lower socioeconomic audience. A lot of outreach is done at those, and we've been seeing it this month, not only with lead poisoning prevention, but with breast cancer awareness, that our agents have been working the commodity distributions for that topic as well. So that's something that they capitalize on frequently. And aside from housing, which both on the local and on the state level, obviously lead poisoning prevention is a huge part of that. Some of the other contents that our agents partner with lead poisoning include green cleaning. We may be one of the only CLIP programs that includes safe sleep in our outreach, but it's all part of a healthy home, that sleep environment. And that's something that we've focused on a lot over the last 8 to 9 years as a state, the safe sleep efforts. And our agents who are doing safe sleep often include lead poisoning as part of that. And again, referring back to our enthusiasm for eco-healthy childcare, the plastics unit in that program has been wildly popular with our childcare folks and the general public, for that matter. When we talk about lead in vinyl and some of the plastic products, it's a natural partnership to include lead with plastic. So that's one of perhaps the more unique places and ways that we bookend lead with other topics.
As a part of the National Healthy Homes Partnership, we are, of course, required to have an advisory group. And we've had one since the onset of this program. But ours really became dynamic in 2013. We had an initial meeting, and that was due to the funding that we got through the partnership. And at that meeting, it was a group of terribly excited folks, very committed folks. The people were from various state agencies. There was a research group that I'll talk a little bit later about, children's hospital folks, nonprofit groups, local community service organizations, other universities and colleges, just advocates, even code officials who see these problems on a daily basis came to this initial meeting. At this meeting, we decided on our name. And this was not driven by Bonnie or myself, it was driven by the partnership. They liked the name partnership because it's a group of equals. And they wanted to show consistency from the National Healthy Homes Partnership to our state. And at the same time, there was also a Memphis-Shelby County Healthy Home Partnership. So part of the goal of this partnership, one of the tasks that we have is to assist communities in developing their own partnerships so that as they have issues or programs that they want to advance, this is kind of a model on how you can pull folks together. So we're very pleased with this. This was the logo they came up with. We obviously used the National Healthy Homes logo and just set it within the state. Excuse me. Right after that, we have been trying to get into the governor's housing conference for years, trying to get on the program, trying to talk about healthy homes, and it just wasn't grabbing their attention. Of course, their main focus is on the financial end of housing, but when they saw this partnership and who all was in this partnership, we were actually invited by them to do a panel to discuss it. So we were ecstatic about this. We don't have a picture of it, but we had a LED exhibit set up in their exhibit space. And that's a coup because their exhibit space is about $800. So they asked us to set that up too. But Dr. Karen Vale works for Extension. She's our urban entomologist, and she's a part of this partnership. In fact, she does all of our training on the pest and pesticides for our agents. So that gives them a little bit more of an interdisciplinary approach, and she's excellent in her work and has a wonderful national reputation. Her deal now is on bed bugs. So we have a lot of good resources for that. Kathy Marcinko is with Le Bonheur Children's Hospital in Memphis. And they have been so proactive, and she has been the driving force behind their partnership. And they learned from going into a lot of the homes of the children they serve that housing is a big issue. And then besides myself, Jeremy Faison was there, and he was kind of there in a dual role. Number one, he owns a pest and wildlife control company, but he's also a state representative. So anything we can do to get them involved and educated about healthy homes is a real coup.
So we spent some time talking about our outreach on the county level. Now we want to move into what we do on the state level. Obviously, one of our major audiences is healthcare providers, whether it's OBGYNs or pediatric providers, making sure that they understand all of the changes that come about with lead poisoning prevention, make sure they can have really relevant conversations with parents as they do those screenings, as they find children who may have elevated blood lead levels. So from the state, one of the pieces that we perform frequently is in-service trainings, whether that's for the Department of Health nursing staffs. The home visitation staffs from the Department of Health are really kind of the on-the-ground folks who see at-risk children in their own homes. And a lot of the home visitors we have actually trained as part of the Essentials course for Healthy Homes so that they can recognize not only lead hazards when they are making those visitations for children, but other housing issues that they can discuss with the parents and perhaps look for resources to help them with that. So we train them across the state and pediatric practices. I've spent a lot of time at Lunch and Learns, particularly working with pediatric nurses and their physicians so that they're keeping track of of what's going on in lead. Of course, we know now that the CDC is really having substantive conversations about lowering the reference level to 3.5 from our current 5. If in fact that happens, it'll be another time to go out and talk with those providers and make sure that they understand what's going on. As I mentioned earlier, a big link to reaching those pediatric practice are those Department of Health regional representatives across the state who have those relationships with medical providers. So we always want to keep them up to the moment and understanding what's new and important with lead outreach. We make it a habit to exhibit and or present for the Tennessee Public Health Association's annual conference and the Rural Health Association of Tennessee. When I came to Extension in 2008 and began working with lead poisoning prevention, there was that perception that lead poisoning is an urban problem, that it belongs to cities, as we all know, like Baltimore, Detroit, my own hometown of Pittsburgh, that those big Rust Belt cities are where people really needed to be concerned. And one of my goals was to make certain that Tennesseans understood that our rural communities are at great risk too. In many Tennessee counties, for decades, there was one road into the county and one road out. And all of us on this phone call today realize that that road is now surrounded by leaded soil. In Tennessee particularly, one of the things that was a novelty to me coming from the Keystone State, where most children grow up and go to college, never to return to their home state, that in Tennessee, in our rural communities, people not only don't leave the state, they reside in their hometown for generations, and in many cases in the same home that their great-grandfather may have built. So they need to understand that those rural farmhouses can be rife with lead and understand the screening and the precautions that they need to take in an older home. So rural health has been one of our focuses for at least the last 9 years or so. And we want to be proactive in not only reaching out to pediatric providers in the here and now, but in educating those younger folks who will go on into pediatric practices, who will go into public health careers. So we make sure that we speak to public health students every semester and they understand before their careers ever begin the importance of lead poisoning prevention.
In 2014, our Healthy Home Partnership project was to do an emphasis on multifamily housing. And I'll talk a little bit more about that later, but that, I cannot tell you how many doors that opened for us. That was part of what got our attention, I think, on the Governor's Housing Conference, along with the partnership. But other groups, ALCO Management is a regional management system. They're in 8 states, and they manage a lot of housing units, a lot of public housing units, as well as private housing units. So they actually had us come and talk to them at one of their annual in-service trainings, and this was all of their managers and all of their properties across 8 states. So that was a tremendous opportunity. 3 Cubed is the research group that I was mentioned earlier. They're one of our partners, and they're a separate organization, but they all have ties to Oak Ridge National Laboratory. But they seek grants and do research on housing. And they actually held a forum here in Knoxville they're looking at some regional research on how weatherization affects a healthy home. affects the families there. So they're very much keyed into this. Reframe is a national organization. It's actually based in Upper East Tennessee, but it supports nationally other organizations and groups that do housing rehab using volunteers as the labor force. So I actually developed a webinar on the safety issues for not only the volunteers themselves, but also for the families. And of course, lead poisoning is a huge part of that because most of the homes are older and they are greatly at risk of actually making a lead situation worse. So the other programming that we have done has really built up these kinds of relationships and reputations.
As we all know, for adults nationwide, the statistics tell us that fully 95% of adults who become lead poisoned is as a result of their occupation. So we try to make sure that we cover that facet of lead poisoning prevention with our children, because we know that oftentimes those workers who are not following the precautions that OSHA demands are bringing lead home to their children. So one of our, I think, more unique outreach things in the last few years was working with Tennessee's Migrant Worker Network to perform an in-service for their case staff who assist our agricultural workers across the state, many of whom are here today and gone in a few months. But those workers, of course, have twofold risk of lead poisoning for both themselves and their families. Perhaps the lead in the soil that they may be working as part of their job, and their temporary and often substandard housing. So those case workers who see the migrant folks are able to share with them precautions, make sure that their children are screened. So that's one piece that we're kind of proud of. We also have presented 2 times at Tennessee's annual Safety and Health Congress, which brings together all kinds of safety professionals, a lot of those in OSHA and throughout industry in the state, to understand the importance of lead poisoning prevention, of following the lead regulations for safety in the workplace. I have done training for at least one manufacturing facility in the state that was actually audited by OSHA and found wanting in their education. So we talked to every member of that manufacturing facility staff to understand the importance of those regulations in terms of not only their own health, but that of their families. And in the last couple of years, we have worked with a local municipality within the state who was audited by EPA for a minor exceedance in their air quality, and wanted to make sure that the community in which that facility was located understood what that meant and how important it was that they made sure that their children were screened. Next Monday, actually, we talked about the importance of our statewide advisory committee. We have an industry coming to work with all of those advisory committee members to fully flesh out what happens in industry in terms of those OSHA regulations, what employees are expected to do, what kind of education employees receive in lead safety, et cetera, et cetera. So we try to make sure that even though we no longer have the ABLES contract that we once had, that we're really keeping our fingers in what's going on with occupational lead poisoning. In our environmental arena, we have had many opportunities to talk about lead in soil, both for the community at large, for our partners in master gardening and other gardening projects. We have been involved with environmental folks at our Tennessee Department of Health who are working with the EPA on some brownfields and soil remediation projects. that we provide the educational piece of that. Earth Day is an opportunity to go out always and either talk about or exhibit about the safety of keeping homes and our properties lead safe. And the Environmental Show of the South, which keeps growing. We are frequent presenters and exhibitors there to reach out to other industry professionals to make sure that they don't understand just the technicalities of lead safety, but they understand the importance of the human health aspects of it as well. Lately, of course, the environmental piece has been increasingly focused on lead and water. The sad reality is that every time there is a lead problem, I guess the silver lining of that is it awakens public receptivity to lead poisoning prevention messages of all kinds. But we've definitely talked about lead and water for, as I'm sure most of you do, in Tennessee. Our biggest issue with lead and water comes from private wells, but obviously with what happened in Flint, a lot of questions about public water supply and lead supply lines. So we've addressed that and again used that to open the door to talk about all of the ways that lead exposure can occur.
In the state of Tennessee, part of Extension, we have worked with a community-based group called, we call it FCE, that's part of the National Association for Family and Community Education. In the old days, it was the old home dim clubs, and this was a way to reach farm families. And some of the first messaging was on canning properly, just basic safety issues in the home, good nutrition. But our organization is still alive and doing well. So we actually developed a leader lesson for them. We produce 4 a year. And the structure is that we develop the lessons, the agents take the lessons and train the leaders of all of these clubs, and then those leaders go back to the clubs and disseminate the information to all the members. So in that way, in Tennessee, we have over 4,000 members statewide. So we took the opportunity to develop a lead poisoning prevention lesson to get out to this audience.
When we talked about county level outreach, we talked about agents working with educational institutions in their own counties. Well, on the state level, we do the same thing, only we do their big brothers or their aunts and uncles, looking at the major conferences that go on related to children and lead and the environment. So this slide just gives you a few that kind of are frequented by me when we're talking about lead. The Green School Summit was an interesting place to serve on a panel and talk about lead in terms of other environmental pieces that can pose a risk in schools, in homes, in communities. The Tennessee School Board Association was an interesting one that maybe is not as well known, but through working with some of the other organizations and do presentations for them, we were invited to talk to the School Board Association. The Tennessee Association for the Education of Young Children, which is Tennessee's branch of the AEYC, is just a super wonderful place. And the early childhood educators really embrace lead poisoning outreach more than just about anybody else I know. And I really have a bent towards making sure that they understand the extent of this problem. As I tell them, I will also tell you that behaviorally, an early childhood educator can often recognize a child who may be lead poisoned with much more easily than that child's parent or even that child's pediatrician, because they understand what a normal 3-year-old behavior looks like. And they understand that child who won't sit still in their classroom, but who can't sit still. Or the bully on the 4-year-old bully on the playground, that a parent may not know whether that's normal or not normal. And a parent may not mention that to a pediatrician, but that early childhood educator can recognize that. And we've made it a mission to make sure that they understand all of the behavioral aspects of it, and can impress on parents the importance of screening, that if that child doesn't come to their classroom screened, that they may have the opportunity to speak to that parent and make certain that that's something that happens as early and as soon as possible. These are some of the places that we perform the big outreach for lead. We produce a quarterly newsletter that once upon a time was strictly lead, and as lead and healthy housing have been enjoying a bang-up marriage for the last 8 years or so, we've made sure that we cover housing topics as well as lead, but these are just a few of those that cover different aspects of the lead poisoning issue. A few of, well, I've done 36 of them over the years, so.
Sometimes we have a unique situation that comes our way. In September of 2016, they were going to have what's known as the Battle at Bristol, and that was to use the Bristol racetrack to host a football game that was going to be the largest college football game ever. And it was going to
Tennessee and
Virginia Tech were set up to be a part of this game. And I can't speak for Virginia Tech, but Tennessee, there's nobody any more committed or crazy about their football than Tennessee. The last few seasons, we're wondering why. But anyway, that's another point. But at this game, there was about 150,000 people that showed up. But around this event, the Holston Habitat for Humanity, which serves the upper East Tennessee counties, which is where Bristol is, and the lower southwestern part of Virginia, they partnered and they wanted to set up another competition. And in what they did, because both colleges have a construction management program, they challenged each school to produce a playhouse. And then they were going to, people could buy chances to get the playhouse, and then the winner would be the one that sold the most tickets,
thereby raising the most money for Habitat.
Right, that would support Habitat. So it was a big fundraiser. But as a part of that, the houses were built, and they decided to do an educational part. So they put these houses on trailers, and the agents in those counties traveled around before the football game. They made 28 stops, and most of these stops were in Lowe's parking lots, Home Depot parking lots, usually on a Saturday, to, number one, bolster support for people buying chances. But also we developed an exhibit that went with it, with kind of an evolving PowerPoint. And this was the page about lead poisoning. We tried to tie everything back to the playhouse, but this was just one of those unique opportunities that we wanted to use to get the message out.
Another thing that we have done in this state that represented, I think, a really unique partnership was taking advantage of our 4-H program. Is we developed a puppet program focused on lead poisoning prevention, and we used 2 of our 4-H homeschooled students to perform that. Its premiere presentation during Lead Poisoning Prevention Week in 2014 in Nashville, our state capital, at an event with our partner, Department of Environment and Conservation. So that script remains. if anyone would ever care to use it, all you need to do is contact me. But it's one way to get a friendly message about lead poisoning out. For many years, I was a volunteer with Kids on the Block, which is an international puppet program, and this program was written kind of along the lines of their 19 educational topics, which do not include lead.
I mentioned earlier that we did the multi-family housing program through our national partnership. We went to 5 different housing apartment communities. One was a private, the rest were public housing, and we actually set up these fairs. As a part of that, we had a quiz wheel with questions, and then we had little things. If they got the question right, they would win a prize, and of course we always made sure they got the question right. And that's a good, very good one-on-one, looking eye-to-eye way to educate about a single point, a single issue. And there were a lot of lead questions on there, along with other healthy housing things. But that has proved to be very successful. We reached a total of 262 folks through these housing fairs. We also did a little survey to see what their concerns were as a part of that grant. But that was very, and agents are thrilled with this wheel. It's out all the time, people using it. If you ever do an exhibit and you have a wheel and that thing is spinning, you'll have a line of people. They may not go anywhere else, but they'll be at that
It's
wheel.
popular for other professionals as well
Yes.
as for the general public to really kind of get them involved in the topic, and we use it with lead outreach frequently. This lesson is one that was kind of fun, trying to take good old Archie Bunker and his kind of rough and ready personality and model it around the concepts of lead poisoning, how exposure can affect a family in a home and a personality. So we kind of wrapped all of the lead poisoning things around it. This lesson was developed specifically. I talked about the Safety and Health Congress the second time we spoke there. It was developed for them, and it has since been used to train other professionals. And if you ever want something a little bit novel to catch people's attention, I'd be happy to send it your way.
There's one other thing I'm going to mention because Bonnie blushes, but if any of you are interested in getting something out in the very near future, Bonnie, who is the best I've ever seen with words, she took the night before Christmas and she wrote a poem and put it in the Lead Prevention and Healthy Housing newsletter about healthy home issues and the night before Christmas. We don't have time to read it now because we're pushing our time a little bit, but if anyone would like this, when it first hit, we had all kinds of people wanting to use it. So again, just let us know and we'll send you the poem. There's just one other thing. I know we're a little over our time, Michael, but we'll make it quick. As I mentioned earlier, when we were working with the city of Nashville, we developed a lead safe housing registry, and now it has sat for a little while. But now that Chattanooga has gotten theirs, they have approached us, and we're going to partner with them and really revise this and give it a new oomph so that it does an even better job than what it's doing now. So, all right.
Okay, that was fantastic. Boy, a lot of information on lead program ideas, and I know everybody's probably overwhelmed with like all the great things that you guys are doing in the University of Tennessee. What I'm going to do now is I'm going to go ahead and unmute everybody's mic. I do want to remind everybody that we are recording this session, and it will be uploaded to both the HUD, Office of Lead Hazard Control and Healthy Homes site, and to the Healthy Homes Partnership site. Just a quick shout out. That the Healthy Homes Partnership website is healthyhomespartnership.net. And there's a tab for educators, and there's a tab that says webinars, and in a few days we should have this uploaded so you can view it. So I'm going to unmute everybody's mic. Hopefully everybody will be somewhat quiet so we can hear everybody. But there is a question from Sharon who says, how can we get copies of the Wheel, Script for Puppets, Night Before Christmas, and All the Family video?
Thank you for asking that, Michael. As I was mentioning those things, I realized that I did not put my email address on this presentation. So when you post it, if you want to include that, that would be great. And all it takes is an email.
Okay. Any other questions from anybody? You can use the chat window, or I do have the mics unmuted, so you can just go ahead and ask the question. I will ask one more time just to make sure that we don't miss somebody. Does anybody else have any questions? Having said that, I appreciate Bonnie and Martha for this presentation. Fantastic presentation, very timely for National Lead Prevention Month, week. And again, we will be sending out information about the recording so that you can go back and look at all of the wonderful things that they're doing at the University of Tennessee Extension. This will be ending.
Michael, I just put our emails in the chat.
Fantastic. So for those of you that were wondering, you can email Bonnie and Martha. They've just put their information in the chat window. I'm going to go and verbally announce it in case someone's just listening. It's bhines@utk.edu. And for Martha, it's mkeel@utk.edu. Again, Bonnie and Martha, thank you so much for this wonderful webinar. And I will be stopping the recording now.